Surgical intervention and rehabilitation of pediatric mandibular fracture following dashboard injury. A case report of a 12-year-old child. This important article is authored by the following scientists. Road traffic accidents (RTA) are responsible for major non-fatal injuries and also fatal injuries annually. Among such injuries, dashboard-related deceleration injuries may cause a wide spectrum of injuries, including complex facial injuries, blunt thoracoabdominal injuries, pelvic fractures, and lower extremity trauma. Pediatric maxillofacial fractures make up 1% to 15% of all facial fractures, which happen because of their distinct anatomical and developmental reasons. These include greater bone flexibility, the ratio between the cranial-to-facial volume, the paranasal sinuses limited pneumatization, and protective features like the buccal fat pad and developing tooth buds. This report underscores pediatric mandibular fracture rehabilitation as a result of a dashboard injury. This article describes the surgical reconstruction of a 12-year-old child who was diagnosed with bilateral parasymphysial mandibular fractures caused by an unrestrained front seat RTA. Multiple abrasions and contusions affect both the central and lateral face regions. A skull X-ray and multidetector CT scans were used to confirm the diagnosis. Under general anesthesia, closed reduction with intermaxillary fixation (IMF) was conducted. IMF is a safer, cost-effective technique for pediatric maxillofacial fractures, as it avoids the complications of open reduction by titanium miniplates and screws, which delay bone growth on the affected side, causing deformity. This technique is mainly useful in settings with few available resources or where advanced fixation methods are not available. Postoperative panorama for follow-up purposes was carried out, revealing proper reduction, normal healing with no complications. The success in treating the 12-year-old patient in this case shows the importance of early diagnosis, adequate surgical technique, and postoperative care in achieving maximum recovery. Introduction. Facial fractures in children are different and more challenging to treat than in adults because kids' facial bones are still growing and have unique features. These injuries often happen during high-impact accidents, like car crashes, and can involve other serious injuries, making proper diagnosis and treatment essential. Road accidents are a leading cause of death and injury in children and young adults, with dashboard impacts being particularly dangerous. When a car suddenly stops, passengers can hit the dashboard or steering wheel, causing severe injuries, including broken facial bones, brain trauma, chest and abdominal injuries, and broken legs or pelvis. Facial fractures can lead to long-term problems if not treated correctly, requiring a team of specialists, including plastic and maxillofacial surgeons. While soft tissue injuries like cuts and bruises are more common than broken bones in car accidents, facial fractures still happen often, especially around the eye and midface areas. To properly assess these injuries, advanced imaging like CT scans is needed. Treatment involves stabilizing the child, surgery if necessary, and rehabilitation for recovery. There isn't much research on how dashboard-related facial fractures affect children, so this study shares our experience in managing these cases. By understanding these injuries better, doctors can improve care and outcomes for young patients involved in severe accidents. Conclusion. A simple and effective way to treat broken jaws in children is closed reduction with intermaxillary fixation, IMF. This method avoids surgery by realigning the jaw and holding it in place with wires or elastic bands. It's especially useful in areas with limited medical resources. IMF helps bones heal correctly, restores normal jaw function, and maintains facial appearance with fewer risks than more complex treatments. In this case, a 12-year-old patient recovered well due to early diagnosis, proper technique, and good aftercare. Because it's affordable and easy to use, IMF is a great option for children who can't undergo more complicated procedures. Thank you for watching this video. Please subscribe to our channel BP International to watch more videos in the fields of science, technology and medicine.